How many women are misdiagnosed with fibromyalgia and RA when actually they're going through perimenopause? Because in med school, many doctors don't receive the education that they need to help women through the transitions of life. So the disease diagnosis of fibromyalgia and RA does absolutely look like perimenopause because the widespread joint pain, fatigue, and brain fog. Now, some people say, hey, I'm in perimenopause. I don't have any of these symptoms. Yes, 1 in 4 of you are going to be a Snoop lucky dog and you don't have those symptoms. And a lot of that has to do with genetics, your lifestyle, your habits, your nutrition, and the nature versus nurture applies here. And if you're in the 1 in 4 that doesn't have that joint pain, I love you and I love this for you. So this might not be for you, but send it to your girlfriend that does. But estrogen helps our hearts, our brains, our muscles, and so it helps us deal with inflammation. It helps us with remodeling. Now, sometimes people can also be misdiagnosed and secretly have a connective tissue disorder called EDS, which they have fibromyalgia-like symptoms because their joints are very lax, and so their connective tissue surrounding the joint isn't stabilizing them as well. Now, the cool thing is their muscles are still able to do all the strength training that they need to stabilize those joints, but then now they even have more irritation because their hormones are changing and they have more inflammation. So one of the best things that you can do if you suspect that you are in perimenopause and struggling with that, first, you of course talk to your doctor. If your doctor doesn't hear you and offer you a conversation, you need to have a conversation with a different doctor. If you want to go to menopause.org, you can type in your zip code and find a practitioner that is educated in menopause near you. You will go on there and see that there are not a lot of people trained in menopause and you will be discouraged. So then you can do a telehealth option like Alloy or MIDI Health because you are not meant to suffer. Now, some people say to me, well, what if I don't want to do hormones? What if I want to manage my perimenopause, menopause transition naturally? Okay, I am a women's health physical therapist. I am always telling women about their bodies and educating you about where you are, the science, healing, and pointing you in the right direction as an ally to help you find that doctor to help you. I am a doctor, but a doctor of physical therapy. So then I talk to you about lifestyle modifications that you can do to help you feel better. And so if you follow me, you know that I am going to tell you about joint mobility, walking, weightlifting. I'm going to talk to you about nourishing your body and sleeping and recovery. And I am always all about the things that you can do that aren't hormones because I don't prescribe them. I just want you to know that estrogen isn't technically the devil you thought it was. And so that's kind of my bend. If you have been with me and you've heard me say this, I am for hormones, but I do understand that the menopause transition is a very unique journey based on who you are, your beliefs, all these things. So if you have fibromyalgia and you think you might not have fibromyalgia and you might have perimenopause, find a practitioner to talk to and start that conversation. And yes, we have to change your habits. You want to hit my little plus sign here and follow along. You can also check out my menopause fitness playlist because I am constantly talking about this to the point that every patient that comes in my clinic will hear this, even my postpartum girls. I even tell postpartum women now about perimenopause, and I tell them, you know how you feel right now, this postpartum horrible feeling where you're like hormonally imbalanced, you feel crazy? If you feel that feeling again someday, you're in perimenopause. Remember this. I'm sorry. Hope this helps.